I attended my first International Women's Conference day on 1988. And in Edinburgh, actually. I won't tell you how old I was then, but I'm just reflecting on how fantastic it is that 28 years on, we're still celebrating the contribution of women and, you know, what our net worth and value is to the way that society has lived in the past, in the present, and the future. So I thought I'd start with a quote, a good woman giving us a good quote to think about. And, you know, there's certain things that I hold importantly to me in the work I do, in the practice that I have every day. And part of it is what Marissa describes there, about the sense of actually taking an opportunity to go places that you've never gone before, to come out your comfort zone, to actually let go of things that are familiar in order to experience something that actually could be quite transformational for you. So I'm really hoping that after today, you're going to start thinking about how you're going to design some of your wow moments and how you're going to bring those to bear as you develop yourself as leaders. So, we're brave in Scotland. That's not a picture of me in the morning. But we're known for many things. You know, we're known to walk about in cold weather with skirts, even the men, as well as the women. My growth and my background in Scotland is a big part of what I am. It's about independence. It's about actually being quite fierce when I need to be, and quite soft when I need to be as well. The start of my life was around golf courses. So my dad was a professional golfer, which meant that every 2 years we used to move house and move communities, and we saw a lot of places, yeah, and we saw a lot of the outdoors. But from a very early age, for me, I learned that life's about emotional connection. It's about relationships. Yeah? It's not necessarily physically where you are, it's how you connect with people. And it's focusing on how you make and create and nurture relationships that actually makes the difference in terms of your practice as a leader. And even today, and you know, in kind of senior roles, particularly in the public service, Stuart and I could spend our week going from committee to committee to committee. Yeah? We actually spend our week by choice in rooms, talking to people, going out to places like this, to hospitals, to connect with people. Change doesn't happen in committee rooms. Change happens when you go out and connect with people that you want to know more about. Yeah? So think about, in terms of what you want to do, how you're going to develop your sense of connection with the world, your sense of connection with each other as you go through your program of work, and your sense of connection with yourself when you think about your practice. The world has changed a lot. When I came in 1979, when I left school, I had a bit of a one-to-one with the deputy rector, who in those days said to me that I'd done really well, and that I had two really, really exciting options. I could be a nurse or a secretary. Yeah? Hasn't life changed? Yeah? And things have moved on. You know, our opportunity to think about what we really want to become is boundless now. The world is an oyster in terms of thinking about what you can do. So from an early age, I decided that actually caring, nurturing, nursing was definitely for me. Next one, please. And I made a very early connection to go to oncology, to go to support and care for people with cancer. But I moved also quite quickly into end-of-life care. And so I spent most of my nursing life in hospice, 10 years of it, where I had the great privilege of working with some fantastic families and caring for them as they went through their life journeys. But I learnt things working in end-of-life care that I have never ever lost. I learnt about the importance of understanding loss. I learnt about the importance of understanding change. And we talk about the loss curve in nursing when we're looking at supporting patients going through journeys like that. But actually, every single job I've held, every place I've been, I always go back and refer and think about the loss and change curve. It's something I've used all of my professional life. And it's really interesting just to think about how we understand people around us as opposed to judging, isn't it? If you follow the work of Stephen Covey and the 7 Habits of Highly Effective People, one of the ones that's really, really important to practice is the whole idea of to understand before being understood. Yeah? And often we jump in and expect to be understood without necessarily thinking about those around us. So take time to think about how you're going to understand really what motivates the people around you, what makes them tick, what presses their buttons. Yeah? Because that's the way you're going to bring people around. You've really got to understand that we're all different, and that's absolutely okay. And the strength of the diversity, whether it's in your work or your home or in this room, is how you're going to affect change. Just going back into health for a little while. This is from an organisation called the Institute of Healthcare Improvement. And why I've put that up there is they've done lots of work in safety and quality. They talk about 3 things. The 3 things you see in the middle there. They say that we all need will, ideas, and execution to make change happen and to make change stick. Now, my invitation, and I've got a couple for you today, but my invitation is for you to think about in your daily practice how much time you spend generating ideas, how much time you spend writing plans, reports, as opposed to how much time you really spend building will. Because most ideas will fail because we don't have will. You know, we've all done it. We've all been in the room where we've said, great idea, and we all leave the room and nobody does anything because there's no will. Yeah? People don't want to do it. And so there is a question about how much time you should attend to as a leader, because that's the job. Yeah? Our job is to create the will, create the conditions for will, so that people want to follow, they want to engage, as opposed to being told to do it. It's also about the translation, isn't it? It's about the language we use. And we spend a lot of time in health trying to present key performance indicators. You know, it just sounds so sexy and groovy, doesn't it? Yeah, a key performance indicator. And then we wonder why we can't get you excited about a KPI. Because the way we actually have a story to tell is what's going to capture hearts. It's what's going to capture commitment. Yeah. We've all got stories. You heard, you know, when Stuart spoke to you, Stuart told you stories. That's what captures people's imaginations, not plans, not KPIs. So think about how you can generate stories and generate what we call narratives, which will help people to really connect with what you're wanting to do. It's far, far more powerful than a plan. That's why at the start of all our meetings, we always try and think of talking through a patient story, a carer's story, a family story, to remind us of why we're here and what we're doing. So think about how you can bring storytelling into the work you're doing and how you can excite people just by telling a story. Yeah? I've put this up and I will leave you the slides so you can refer to them over the coming weeks. But why I put this up is because it's really important for us to understand that most of the time that we work, we don't spend our time on top of the water. We spend our time under the water. We call it the shadow organisation. We call it working in the shadows. It's the bit that we all know, but nobody really says, that most key conversations happen in corridors, in coffee rooms, don't they? They happen when people get together informally. And you can tell a lot about a team or a department or an organisation just by walking around. It's the stuff that you don't see in the reports, but it's the stuff that you know tells you about the culture and the climate that's around the people that work in that team. So do think and attend to whether you're connecting with the shadow side, of the organisations that you're working in, and also the shadow side of the people that you connect with. Because what you see is not necessarily what's behind what you see in terms of getting to know people. We talk about an adoption curve in improvement, and why I put that up there is so you can see that, so whenever we take forward change, we know we've got a curve. We've got the people who are running in the door saying, I've got a great idea. They're innovators. They've always got a really radical thought that we want to try. And then we've got people who might want to come around, but they sit on the fence because they want to see some evidence before they come and join the innovator, don't they? And then we've got some people who actually are just happy where they are, and that's okay. But why I put it up was also to help you see that there's also a danger about being on the left. And the danger about being on the left is you can be so enthusiastic, you can become a bit heroic. Yeah? You can be so fast on your own bus, taking your own idea forward, that actually you haven't got any followers. And if you look at great pieces of change that have happened, people might have taken forward a great idea, but it's only really got traction when somebody gets their first follower, right? Because you need followers to help that to happen. So we say there's no room for heroes in change and in improvement and quality. This is about distributive leadership. This is about people coming together as a collective. This is about people owning things. And if you want to watch a bit of YouTube when you go home tonight, there's a fantastic clip called Dancing Guy. If you watch Dancing Guy, you'll see the story of what it's like to be an innovator without a follower, and then how your life changes when you get a follower. Yeah? So please have a look at it. In terms of what we could actualize here, it's massive, right? We do get bogged down in the day-to-day work of thinking our life's about performance. It's about delivering certain objectives. It's about doing what people expect of us. But the challenge for all of us in the room is, are we prepared to go to the second curve? Are we prepared to get more transformational, to try things we've never tried before, and to go to the margins where most of the innovation happens in organizational life? But the other invitation is, are we prepared to go to the third curve? Are we really prepared to partner and co-produce with our communities in a way that's fundamentally different? How much different could our lives be if we actually got into true partnerships with communities and citizens, as well as organizations? And that's about thinking about assets. If everybody is an asset, then the community is an asset, and the people that live in our communities are assets that we could use very, very differently in terms of their wisdom, their ideas, their skills. And so there is a question about whether we should be really pushing ourselves to move to the third curve. Now that's going to be risky, and that's going to be different, because that means sharing power. That means sharing leadership in a very, very different way. And, Mid-North have done a lot of work and are already in the third curve. I've heard a lot of great things as I've been driving down with Stuart this morning. You've got so much opportunity to be really leading that third curve of work. Lots of opportunities. Life has changed in terms of even health for us in that third curve. If we'd been drawing this picture 5 years ago, we would have put the hospital in the middle, wouldn't we? And the community would have been a way out to the edge. There's a very different view about what it means to look at health and well-being. And it's about the person, the citizen, the resident, being at the center of everything that we do. And that as organizations, we're there to support that. It's a very different model. We talk about flipping healthcare, flipping the model upside down, turning it in a very, very different way, and thinking about how that drives our thinking, our design, as opposed to traditionally what used to be the buildings, the fabric of hospitals, and how we could do that differently. So what are some of the ways that we might do that? There is a notion in health and in public service that, and certainly in the many early jobs I had, that in order to be a leader, you needed to be in control. You needed to have certainty. You needed to have order. You needed to always know what was going to happen next. But that's not the case, because the strength of moving to the third curve, right? The strength of being really transformational is actually to let go. And we talk about the notion that you should ask forgiveness, not permission. Yeah? So you just do it. I'll say this when Stuart's here, so you can all ask him forgiveness when you go out. There is this sense of we actually wait too often for permission when we should just go and try, have a test of change, try an improvement. We've got it within our gift to do that. But we don't need certainty to make change happen. We can't control it. And if you want to look at your leadership practice, part of what is worth thinking about is how are you going to hold things lightly? How are you going to let change happen over here? How are you going to network people so you're not in control of it all the time? Emergence is something that's really exciting. And that's what you're building the design of your program on. You know, you're coming together to think about how you want to design and respond to the emergence of your leadership program. But it's really stressful for some people because we like control, don't we? It's something that we feel is good. So there is something to think about how you can work in the grey. Yeah, it's a lot easier to work in the world of black and white. But working in a world of uncertainty and ambiguity is actually something that all leaders need to do. And it's just thinking about how you might do that might be a really useful conversation for you to have as part of this program. So I'm sure Gail's thinking that she'll give you a step and then you're going to design the next one, yeah, as we go along. The other thing that I've learned and I've seen and I've noticed is that some of the best change is also about coming right out of your comfort zone in terms of health. And we've, in Scotland, we decided that our future for children was pretty poor. You actually didn't have, depending on where you lived, you actually didn't have a good future in front of you if you were a child in Scotland 2 or 3 years ago. So we decided that we needed an ambition. And that ambition was to make Scotland the best place to grow up in. It was about making a commitment to change the lives of every child. Now, that ambition in itself means that from day one we knew we couldn't fix it. We had to bring in lots of other people to do it. And these are the 300 pledges that we got signed on the day that we brought 300 leaders together into the room from all the different organizations that we knew, from health, from housing, from employment, from local government, from transport, from police, from fire. And we got everybody in the room to build will. So we're back to will. Before we did anything, for a whole day, we sat in the room to get to a point we could all pledge. Pledge to change the lives of every child and do it together. So there's something to think about around who are you not connecting with, who are you not working with just now, that if you started to bring them into your circle of influence, you could change somebody else's life together. Who out there could you do it with? We talk about coalitions, and this is about the notion that, leadership is quite interesting, because when we all give out our bios, we give out our bios which are lists of jobs, don't we? I did this role, I went to this role. Leadership's not about jobs. Leadership is about practice. Leadership is about a way of being. And a coalition is about a group of people who in themselves believe they've got the influence, the motivation, and the passion collectively for a joint purpose. And you don't have to be the most senior person in an organization to be in a coalition. You just need to be in a group that has a purpose that's joint for change. And so this is just something to think about in terms of your own work, about how you can connect with other people out there who've got the same values that you've got, who've actually got the same purpose that you've got, who might want to change the lives of every child. And Peter Senge, who some of you may have read, has done a lot of writing on learning organizations. His challenge to us was going back to think about our more emotional side and say, stop being mechanics. Stop trying to put things in logical order. Start training as gardeners. Start nurturing. Your job's fertilization of ideas, fertilization of will. And how could you do that differently as you go? And lately, probably in the last 5 years of my professional life, the place I have learnt the most from is local communities. So when we got into thinking about our third curve, we thought, well, what's the first thing we need to do? We need to actually go and understand communities better. We actually asked community activists to come in and work on our teams. They challenged us. We had great conversations. And we learned a lot that we didn't know. But it also taught us that actually helping communities to understand what matters to them is going to help us do our job better. But that's a different conversation than the one we currently have. Because quite often, we're often keen to tell people what we think should matter to them, as opposed to a community deriving that for itself. There's been a lady called Margaret Wheatley has done a lot of writing on this. So there is a question about how you connect back with the community, how you actually allow the ideas and the innovation from your local community to drive your leadership, to drive the ideas that you need to do next. It doesn't all have to come from us. Now, some of our best, we put up an innovation fund of £1 million that could only be accessed by members of the community, not by the organizations. And the ideas was stuff that we would never have thought about because it mattered to that community. So, another invitation for you there. So I'm going to leave you with some last thoughts before we go to the panel. 5 things for you to think about as leaders, either past, present, emerging, future, or all of the above. That how can you think about being person-centered in everything you do, in everything you say, in everything you practice? We talk about authenticity, and it's something that's worth talking about further in your program of work. How you actually demonstrate to people that you're authentic in your leadership, that what people see is what they get, and that you can create trust and really strong emotional connections with people because of that. Your focus, your transparency, and your ability and your willingness to go out of your boundaries and to go out of your comfort zone. And this bottom bit is really for us in quality and safety. It's about talking about the role of leaders who actually are happy to share the things that go wrong as well as the things that go right. That's the stuff you learn from. And we need to be much more open about not needing to be perfect all the time, don't we? And thinking about how we can share that. So, everybody here has got the ability, has got the permission, has got the opportunity to be disruptive. My last boss at Western Sydney actually said to people that I was a disruptive innovator, which was fantastic, because I actually had permission to do it. But you don't need permission. You actually all have the ability to do that today. It's in your circle of influence that you can do this. It's up to you how you want to practice it. Yeah? But disruption is good. Yeah? Sometimes we get very used to the rhythm of familiarity and the rhythm of what's safe and the rhythm of what we've always known. Yeah? And you know, one of the reasons that I signed a contract to come over here at the age of 50, knowing nobody apart from my husband, and only having him to talk to, which is a risk, was to come out of your comfort zone and do something really, really different is a way of stretching yourself. It's a way of doing something different. And I've loved it. I've done things I would never have done before. So you've got to think about how you're going to jump out that goldfish bowl over the coming weeks and see what you need to do. And lastly, I'm just going to leave you with this thought, because I once had a great conversation with a clinician when I was on a visit over to the States. And there was a challenge and an invitation in the conversation, which was 1962 is the year I was born. I know you can't believe I'm so young. 1962 is the year I was born. I don't know what number's going to be on the other side of that. But the invitation is, what do you want your dash to be? Yeah? What do you want to be in your dash when people talk about you? What difference have you brought? How would people describe you as a leader? What did you bring to bear when people describe how you practiced in the dash of your life? Yeah? So I'm going to leave you with that to think about, and thank you.